Bismillahirrahmanirrahim. In the name of Allah, the most merciful, the most compassionate. His Excellency Datuk Mahmud H.S. Kuantan, Ambassador of the Kingdom of Saudi Arabia, the IIUM Board of Governors, Yang Berbahagia Professor Emeritus Tan Sri Datuk Zulkifli Abdul Razak, the Honorable Rector of the International Islamic University Malaysia, Professor Dr. Kamaruzzaman Yunus, the IIUM Kuantan Campus Director, IIUM University Management Committee, Professor Dr. Muhammad Taher bin Bakhtiar, the distinguished speaker, deans and directors, brothers and sisters. Alhamdulillahi Rabbil Alameen. Wassalatu wassalamu ala Sayyidina Muhammad wa ala alihi wa sahbihi wa sallam. Assalamualaikum warahmatullahi wabarakatuh, and a very good morning. Welcome to the IIUM Professorial Talk by the Professor Dr. Muhammad Taher bin Bakhtiar, entitled Drug Discovery and Development Prospects and Challenges, bring to you exclusively by the Office of Academic Service Unit, Office of the Campus Director, IIUM Kuantan Campus. My name is Muhammad Salahuddin Haris, and I am the MC for today's event. To gain barakah from Allah Subhanahu wa Ta'ala, let us begin our session with the recitation of Furqan Al-Fatiha. Amin, Amin, Ya Rabbal Alamin. Distinguished guests, brothers and sisters, for your information, in the chat box, the program book and attendance links are shared. Additionally, we are delightful to launch today an e-book entitled Drug Discovery and Development Prospects and Challenges, written by our honorable speaker. The e-book is a complimentary from IIUM Press. Distinguished guests, brothers and sisters, we will now play you our national anthem, Negaraku, and followed by IIUM song, Leading the Way.
Let's lead the way, enlighten the future, share the wisdom to the spirit of Islam. Revelation and reason, we shall excel, we shall prevail. the knowledge the Khalifa, we will fulfill the amanah. Together we make the world a better place forever. Expand the culture of Iqra. IIUM is to realize the meaning of Ramadan al-Alamin. Together we make the world a better place forever. Expand the culture of Iqra. IIUM is to realize the meaning of mercy to all the world for all mankind.
Welcome back, brothers and sisters. Before we begin with the ceremony to seek blessing for this event, I would like to invite Ustad Dr. Felza Zulhibri Abdul Hamid from Selpat IIUM Kuantan to recite dua. فيتفضل مشكورا.
السلام عليكم ورحمة الله وبركاته. الفاتحة. إياك صراط الله. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله على ما يسره من نشر منقول حروف العشرة، ثم الصلاة والسلام السرمدي على النبي المصطفى محمد وآله وصحبه ومن تلا كتاب ربنا على ما أنزل. اللهم إنا نسألك موجبات رحمتك وعزائم مغفرتك والغنيمة من كل بر والسلامة من كل إثم والفوز بالجنة والنجاة من النار. اللهم نور بكتابك أبصارنا وأشرح به صدورنا واستعمل به أبداننا وأطلق به ألسنتنا وقوي به قلوبنا وأسرع به فهمنا بحولك وقوتك، فإنه لا حول ولا قوة إلا بك يا أرحم الراحمين. اللهم اجعل جمعنا هذا جمعا مرحوما وتفرقنا من بعده تفرقا معصوما. اللهم إنا نسألك العافية في الدنيا والآخرة ونعوذ بك بكلمات الله التامة من شر ما خلق. اللهم ادفع عنا البلاء والوباء والفحشاء والمهن ما ظهر منها وما بطن عن بلادنا هذا وعن بلاد المسلمين. اللهم زينا بزينة القرآن وأكرمنا بكرامة القرآن وشرفنا بشرافة القرآن وألبسنا بخلعة القرآن وأدخلنا الجنة بشفاعة القرآن وعافنا من كل بلاء الدنيا وعذاب الآخرة بحرمة القرآن. اللهم اجعل القرآن لنا في الدنيا قرينا وفي القبر مؤنسا وفي القيامة شفيعا وعلى الصراط نورا وإلى الجنة رفيقا ومن النار سترا وحجابا وإلى الخيرات كلها دليلا وإماما بفضلك وجودك وكرامك يا كريم. وصلى الله على سيدنا محمد وعلى آله وأصحابه وسلم. سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين. السلام عليكم ورحمة الله وبركاته.
Jazakallahu khairan jaza ya Ustaz. Distinguished guests, brothers and sisters, without further ado, let us listen to a welcoming speech from Honorable Professor Emeritus Tan Sri Datuk Zulkifli Abdul Razak, Director of the International Islamic University Malaysia. Please welcome Tan Sri.
Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Wassalatu wassalamu syafil anbiya mursalin sayyidina Muhammadin wa ala alihi wa sahbihi ajma'in. La haula wala quwwata illa billah. Assalamualaikum warahmatullahi taala wabarakatuh. Brothers and sisters, let me first of all thank you and Allah Subhanahu wa taala for giving me this opportunity to participate in your professorial talk given by Professor M. Taher Bakhtiar on the title Drug Delivery and Development Prospect and Challenges. Indeed, I am very pleased to be with you to listen and to also learn from the talk that will be given by Professor Taher. And I think this is a very timely talk given the world that we are in today, the pandemic world, where drugs and drug delivery is an important issue for us to understand. Indeed, from the perspective of Islam, drugs and drug delivery is something that is synonymous to the history of science and medical development as far as Islam is concerned. Names like Ibn Sina or Avicenna, as far as the European is concerned, is one of the names that is still very much alive in the world of science today. Sir William Osler, a very well-recognized medical scientist in the European world, recognizes the work of Ibn Sina as a fundamental work that gave rise to many things in medical sciences and also pharmaceutical sciences in the long run. For 500 years, his work is used in the European universities and also academies to guide them to find out what science and medical sciences is all about in the care of human being and also the population at large. This is a very important statement to make because Islam, as it advocates in the world of medical sciences and health sciences in general, is to look after the welfare of the ummah, the people around him, part of our fardu kifayah, ensuring that well-being and wellness is part and parcel of the Muslim ummah. This is a very important statement as we talk about sustainable development today, or sustainable health, which has the same intention in trying to bring healthcare in a fair, just, and equitable way to everybody around the world. Healthcare now is a right for everybody. No one should be left behind as far as healthcare is concerned. Hence, including the distribution of drugs, the manufacturing and the generations of new products for the use of mankind as a whole. And therefore, I think it is an important time for us to revisit some of these concepts, some of this philosophy, as what science is meant to be, particularly in medical sciences and health sciences, where people now are dependent on this knowledge to keep themselves fit, to make themselves healthy, and also to be useful to the society at large. But as we go on, as we see today, the word drug delivery and drug development has taken a very different orientation. With the introduction of patents, intellectual property rights, and copyrights, and so on and so forth, you find that these knowledges are no longer meant for the people at large. These are knowledges that have been monopolized by a certain group of people, and it is sold as part of a commodity to those people who are able to afford medical health and health sciences so that they can benefit from it. The larger majority of the world today are not even close to what we call the medical sciences and the knowledge that is contributory to them. And therefore, the change or the contradictory change from what the Muslims and the Islamic world was trying to advocate, that medical sciences is meant for all, now has gone into a very different kind of a perspective. As you can see today, in the world of vaccines and vaccination, as far as the pandemic is concerned, you find there is words like vaccine nationalism, vaccine appetite, vaccine hesitancy. All this is an indication to show that the distribution of vaccines around the world is not an equitable one. is not a fair one, neither it is a just one. And therefore, when we talk about drug development today, we need to be assured that these products will be used for everybody around the world, not only for the few who can afford this, or the few who want to monopolize this for whatever reasons other than medical sciences and the healthcare of all mankind, as it were. And therefore, these are issues that I hope Professor Taher will address and make sure that all of us in this university understands what medical sciences is for. It is for Rahmatan lil Alamin, as this university advocate. And therefore, we need to reconceptualize, we need to re-understand, and we need to put back science to where it was, and it is meant for the people. I would like to end by quoting Jonas Salk, the father of polio, when he invented polio in 1954. And this is the first successful polio vaccine that was used for the people around during that particular time. When he was asked, whose patent is this for? Jonas was very frank in saying that it is the patent for the people. In fact, he repeated, he said, there is no patent. And in fact, he asked the person who asked him this question, can you patent the sun? In other words, as far as he's concerned, the patent for vaccine do not exist. Vaccines are meant for everybody, just like the sun is meant for everybody. Nobody owns the sun. Nobody benefited from the sun in a commercial way, but yet the sun is there for us, all of us, to benefit from. And this is a stance that I think he took, and I think this is a kind of a wisdom that we need in the world today. For those people who want to monopolize and make commercial benefits out of vaccines will be looked upon as a person who do not belong to the world. These are the people who actually want to benefit from the commercial interest that they've got. And many a times, this commercial interest come from public good that is invested by government in many institutions that work for free as far as the developments of drugs and vaccines is concerned. On that note, I would like to thank you once again for giving me this opportunity to share some of the thoughts that I have, that we in the university has got more role to play instead of just developing and delivering drugs and whatever other medical product. We need to make sure that it's done in a way that is compatible to the Islamic principle, that is for Rahmatan lil Alamin. On that note, I wish you well, and I hope this lecture today will be able to expand our mind and to make sure that we will be the spokesperson of people who wants to benefit from this product of ours in a way that is advocated by Islam. Wabillahi taufiq wa hidayah. Assalamualaikum warahmatullahi ta'ala wabarakatuh. And thank you.
Thank you so much, Tan Sri, for those exquisite welcoming remarks. Before we begin with the talk, I would like to invite a representative of Dean Kulliyyah of Pharmacy, Associate Prof. Dr. Hazrina Abdul Hadi, to read a short biography of our honorable speaker.
Sana, pegang. Come.
Alhamdulillah. Distinguished guests, brothers and sisters, before we begin, I would like to invite a representative of Dean Kulliyyah of Pharmacy, Associate Prof. Dr. Hazrina Abdul Hadi, to read a short biography of our honorable speaker. Please welcome Dr. Hazrina.
Assalamualaikum warahmatullahi wabarakatuh, and a very good morning. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Assalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Thank you very much to our MC, Assistant Professor Dr. Salahuddin. First of all, I would like to welcome and thank our honorable guests for joining this Professorial Talk 2021. His Excellency Datuk Mahmud Kuantan, Ambassador of the Kingdom of Saudi Arabia, the IIUM Board of Governors, Yang Berbahagia Professor Emeritus Tan Sri Datuk Zulkifli Abdul Razak, the Honorable Rector of the International Islamic University Malaysia, Professor Dr. Kamaruzzaman Yunus, the IIUM Kuantan Campus Director, IIUM University Management Committee, Professor Dr. Muhammad Taher bin Bakhtiar, the distinguished speaker, deans and directors, brothers and sisters. I am here on behalf of the Dean for Kulliyyah of Pharmacy, Assistant Professor Dr. Juliana Jafri, to introduce our speaker, Professor Dr. Muhammad Taher bin Bakhtiar, to everyone attending this event. Professor Dr. Muhammad Taher bin Bakhtiar was born on 16 March 1973 in Bukit Tinggi, West Sumatra. He completed his Bachelor of Pharmacy with honors from the University of Andalus in 1997. He has completed his final year project entitled An Alkaloid from Ophiorrhiza Species, which was supervised by Professor Dr. Dayar Arbain. His interest in research grew because of this final year project. He then pursued his professional pharmacy program at the same university and obtained his professional pharmacy certificate in 1998. During his undergraduate years, he was actively involved in several undergraduate organizations such as the Pharmacy Student Association. He was also one of the Student Senate Committee members for the Faculty of Mathematics and Natural Sciences at the University of Andalus. After completing his bachelor's degree, he furthered his studies at University Technology Malaysia for a Master of Science degree in Organic Chemistry in year 2000. His master research project was on the chemical and bioactivity studies of 3 selected gadiferous species under the supervision of Associate Professor Dr. Muhammad Sum Idris. He then later obtained his PhD degree in 2005 from the Bioprocess Department, Faculty of Chemical Engineering, UTM, focusing on the anti-diabetic studies of cinnamon extracts on adipocyte cells, understanding the mechanism of hypoglycemic activity of cinnamon extract and its active principle on adipocyte cells. His PhD project was supervised by Professor Dr. Muhammad Roji Sarmidi and Professor Dr. Fazila Adiba Abdul Majid. Soon after completing his PhD, he joined UTM as a visiting lecturer for a few months. His journey with our beloved university, International Islamic University in Malaysia, started in April 2006 as an assistant professor at the Department of Pharmaceutical Technology, Kulliyyah of Pharmacy, IIUM Kuantan. 5 years after joining IIUM, he was then promoted to associate professor. Professor Dr. Muhammad Taher has vast experience in teaching undergraduates and also supervising postgraduate students, both masters and PhDs. As an active researcher at IIUM, Professor Dr. Muhammad Taher has received a number of research grants from the university, the Ministry of Higher Education, and the Ministry of Science, Technology and Innovation. Most of the research projects that he was involved in were related to biotechnology and cell cultures. His passion in cell culture motivated him to actively involved in the establishment of the Animal Cell Culture Laboratory at the Kulliyyah of Pharmacy. It is worth for me to also mention, despite of his many duties in teaching and research, he is also a good academic administrator. He held various positions such as CPD Coordinator for Kuantan Campus, Deputy Dean Postgraduate and Research, Head of Research, and Head of Department for Pharmaceutical Technology. Publish or perish, we heard this all the time in academia. However, it is more than that. Sharing data isn't just good for science, it's good for the Ummah and community as a whole. By publishing our research work, it is not only give rise to new collaborations and to boost our academician reputation, but more importantly, we can share and disseminate the knowledge with the Ummah and community. As for Professor Dr. Muhammad Taher, he has indeed contributed to the academic world and to the Ummah, whereby he has published more than 100 articles in index journals and a number of book chapters and books. These publications has received more than 1,000 citations, which give him an H index of 21 in Scopus. His expertise in research and publication has made him well known in his area of expertise, and thus he has been appointed as an editor in several journals such as Biomedical Research International, Evidence-Based Complementary Medicine, Makara Journal Health Research, Herbal Medicine Journal, to name a few. He is also an active reviewer for several high-impact journals such as Journal of Ethnopharmacology, Toxicology Reports, Phytomedicines, Saudi Journal of Biological Science, and many more. His expertise in the field has been sought after by several academic institutions. He was appointed as an external expert panel for the undergraduate pharmacy program at IMU back in 2013, and an expert panel for the undergraduate and postgraduate pharmacy programs at University of Malaya from this year 2021 to 2024. He also has received several appointments as a master and PhD thesis examiners, not only in IUM, but also at UTM, UPM, UMP, University Brunei Darussalam, Universitas Andalas, and Anamala University. He is also an experienced university panel for research grant applications such as FRGS and eScience, and also a panel for the Ministry of Higher Education Indonesia. IIUM, the Garden of Knowledge and Virtue, appreciate all this hard work and great achievements by Professor Dr. Muhammad Taher. Therefore, in March 2020, he received this well-deserved promotion to professor. Lastly, I would like to share some words of wisdom by Hendrik Rohrer, the father of nanotechnology and a Nobel Prize winner. Science means constantly walking a tightrope between blind faith and curiosity, between expertise and creativity, between bias and openness, between experience and epiphany, between ambition and passion, and between arrogance and conviction. In short, between old today and a new tomorrow. As for today, I hope that Professor Dr. Muhammad Taher's great achievements will inspire us all here to be tomorrow's Murabbi and Khalifah for Rahmatul Lil Alamin, inshallah. With that, I end my biography presentation of our distinguished speaker, Professor Dr. Muhammad Taher bin Bakhtiar, with wabillahi taufiq wal hidayah. Wassalamu alaikum warahmatullahi wabarakatuh. Thank you.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Dr. Hazrina, for the inspiring introduction. Dear participants, before we begin, I have some housekeeping announcement. Please make sure your microphone is in mute mode throughout the session. The talk will be an hour, followed by a 15 minutes question and answer session. For the question and answer session, you are invited to post question in the chat box. Please write your name and kulliyah or center at the beginning of your question for identification. We will read the question for you. Without further delay, we will now invite the presenter, our distinguished Professor Dr. Muhammad Taher bin Bakhtiar, to deliver his talk on drug discovery and development prospects and challenges. Please welcome Professor Taher.
Thank you very much, Dr. Salah. Allow me to share my slide. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin wassalatu wassalamu ala asrafil anbiya'i wal mursalin Sayyidina Muhammadin wa ala alihi wa sahbihi ajma'in. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. His Excellency Datuk Mahmud Kuantan, Ambassador of the Kingdom of Saudi Arabia, the IIUM Board of Governors. Yang berbahagia Profesor Emeritus Tan Sri Datuk Zulkifli Abdul Razak, the Honorable Rector of the International Islamic University Malaysia, Professor Dr. Kamaruzzaman Yunus, the IIUM Kuantan Campus Director, IIUM University Management Committee, Deans, Directors, brother and sister. Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera. It is my great honor to be here to share my little knowledge on research with all fellow colleagues. First of all, I would like to thank Office of Campus Director for giving me an opportunity to deliver this talk. Indeed, I totally agree with the speech by our transit directors that drug discovery and development is relevant to be our topic today. Drug discovery and development is a vital process before any drug can be introduced for the clinical use. Undeniable, the process to produce a single drug that is safe for the human body and effectively treat specific disease without any side effect is lengthy and very costly. It starts from the curiosity of an emerging disease or the absence of effective indication and is translated into scientific and clinical study through various research approaches, such as from jungle to bench, from culture to vial, and from waste to vault. This chart shows you the process of drug discovery and development. This process is quite lengthy. It is about 12 to 15 years, and it can take cost about $1 billion US. If you can see here, the process of selection is very strict. From discovery, about 10,000 compounds that we propose to be studied, just only one will be available in the market. This process must be followed by drugs and also for new drug and also current drug. With case with the ivermectin, actually it should undergo this process again, because we change the indication from the antiparasite to be antiviral. It must undergo phase 1, phase 2, and phase 3, because it has been changed for the formulation and also their dose. If we don't do this kind of study for the clinical trials, we afraid that the drug in future will be showing the toxic effect to the people. With regard to drug discovery and development, Islam is Rahmatan lil Alamin, encourage the humankind to do exploration to the nature, such as in Surah Al-Baqarah 164. Indeed, the creation of the heavens and the earth, the alteration of the day and the night, the ship that sail the sea for the benefit of humanity. The rain sent down by Allah from the skies, reviving the earth after its death. The scattering of all kinds of creatures throughout, the shifting of their winds and the clouds drifting between the heavens and the earth. I saw a sign for the people of understanding. You can see that and the last of this, the meaning. So all of these things is created by Allah for those who are using their mind, for those who are willing to study, for those who are willing to explore the nature, including in drug discovery and development. Other surah also mentioning about this encouragement to do exploration, to do research. Like in Surah Al-Imran 190 to 191, indeed the creation of the heavens and the earth and the alternation of night and the day a sign for those who understanding, who remember Allah while standing or sitting, lying on their sides, give thought to the creation of heavens and the earth. Our Lord, you didn't create this aimlessly. Exalted are you, then protect us from the punishment of the fire. Human being is the best creation of Allah. It is created with free will. Free will means it can be good people and also can be bad people. Even though we know that actually the creation of human and jinn is to worship Allah, but human beings play important role to the color of the world, whether they would like to develop to be a good world or to the bad world. Na'udzubillah min zalik, it can be evil on earth. As mentioned in Surah Ar-Rum 41, corruption appeared, and also a disaster on earth and sea due to the hand of human. But as a Murabi and or Khilafah in the world, we have to play important role to betterment of the Ummah. Indeed, our Islamic scholar during the golden age of Islam, like Jabir ibn Hayyan, founder of modern pharmacy, has started their journey to do research. He has published hundreds of books, and also hundreds of books in philosophy. Not to forget Ibn Sina as a modern physician. In fact, the human being has been started to explore nature long time ago. Samples the people in Mesopotamia, 2400 BC, they use clay, the tablets. With regard to drug discovery and development, if we relate it with maqasid of al-Sharia or objective of al-Sharia, that contains 5 elements, including protecting life, encourage us to do ijtihad, to do effort, especially to fight against pandemics. And also it is related to one of hadith, Sahih Bukhari, there is no disease that Allah has created, except that Allah also has created the cure. Meaning to say, our effort in drug discovery and development are based on Al-Quran and Hadith, meaning to get barakah from Allah, meaning we need to do this kind of activities. IIUM as IIUM as international award winning in sustainability has launched a book on Sejahtera academic framework to guide academician for future academic duration, to produce a well-balanced graduate, which is embed core element, higher core, which is Khalifah, Amanah, Ikra, Rahmatan lil Amin. It is as a manifestation of falsafah pendidikan kebangsaan using jari plus khas domain, jasmani, emosi, rohani, intellectual plus hamdulillah, alam, and social. Islam has been leading to protect all aspects of human life, including for medicine. Yeah, it has been mentioned in Quran and Prophet. Yeah, some plants that can be used for medicine. Yeah, for example, Allium cepa, yeah, Allium sativum, poinic, and so on. So that by inspired by this evidence, meaning there opportunity to us to explore the nature through drug discovery and development. With regard to this, our ancestor has been experienced to use natural products and herbal medicine for medicine, like using jamu in Malay culture or in Nusantara. But this kind of practice got some challenges. Yeah, the first challenges is regarding with regard to the dose. Yeah, normally the plant was infused, yeah, was extracted using water, so we don't know the dose, yeah, that been consumed by the people. Other thing is with regard to stability, yeah? Because normally they use water, yeah, to extract the active ingredient from the plant extract from the plant. It can cause contamination. Other thing is with regard to standardization. In traditional medicine, we don't know actually how much the active ingredient in there. We just extract it and just consume. Yeah, and then about hygiene. Yeah, the hygiene also become a problem because it prone to be contaminated, yeah, by salmonella and other type of bacteria. And last one, the challenges is additional of drugs into the product. Yeah, for example, for diabetes, normally they add metformin, yeah, for calm and sleep. Sometimes they put diazepam, yeah, and for the sexual dysfunction, normally they put sildenafil, yeah, pain relief. They use paracetamol, and for rheumatism, they use a steroid. Yeah. But nowadays, we get the commercialization of traditional medicine. They produce the product in form of tablet or capsule, yeah, in form of extract, which is the dose is measured, and it is standardized according to the active compound, and then it undergo GMP process, yeah, and of course it will increase the stability. You see the global demand of the traditional medicine. In Africa, more than 90% people, and also in India, 70% of the people are still depending on traditional medicine. In fact, traditional Chinese medicine has been used for 3,000 years ago. And if we see the top-selling botanical nowadays, like ginkgo biloba, Allium sativum, and also panak ginseng. About 177 drugs approved worldwide for the treatment of cancers. More than 70% are based on natural products or derivative. So that to make it available worldwide, one roof regulation is needed. Brothers and sisters, I would like to share with you the small nature, I mean the product from nature that has been used for the drugs. the most the most widely used for anti-cancer drugs nowadays is coming from the herbs, yeah, from Taxus brevifolia. The active compound is paclitaxel, and another one is vincristine. Yeah, it is coming from the Catharanthus radius. For the development of these drugs from herbal, the role of pharma industry through their sponsor and developing is very important. Even to see the top 10 pharmaceutical companies with high revenue in 2020, yeah, to show that the role of pharmaceutical industry is very important, yeah, in drug discovery and development. The first is Johnson & Johnson, yeah, followed by Pfizer and so on. So in 2021, we expect Johnson & Johnson and Pfizer will still on the top of the highest revenue because of their product with the vaccine, yeah, with the vaccine COVID-19. Yeah. So meaning they are still growing and leading the pharmaceutical industry in 2021. And then we get the leading pharmaceutical product sales in terms of sales in 2020. Yeah. The first, the top sales drug is Humira. Yeah. Humira is monoclonal antibody products. Yeah. The product that can be used to treat rheumatic arthritis. Yeah. Rheumatic arthritis. And if you can see this chart, yeah, mainly the product is coming from the biotechnology product, yeah, monoclonal antibody, and also small molecules. Brothers and sisters, global challenge in drug discovery and development. Actually, the global challenge nowadays with regard to drug discovery and development is with new drugs for anti-cancers. Many diseases nowadays, cancers are resistant, yeah, to the treatment with the current drug. And we want that anti-cancer to be targeted. As we know that the anti-cancer drug has a huge side effect to the people, yeah? A systemic effect. And then other challenges with new vaccines, new strain of virus like COVID-19. We also got a challenge in here. So many companies nowadays trying to develop, yeah, their own vaccine. As we know, for the vaccine COVID-19, some companies propose their product, yeah, with their some advantages and also disadvantages. Other challenge is with regard to the improvement of drug delivery. Yeah. So with this improvement of drug delivery, we can increase efficacy and also reduce toxicity. One of the strategies to deliver anti-cancer drug is by using antibody drug conjugate. Yeah. So if we see here, yeah, anti-cancer drug is conjugated with antibody, yeah? And then the drug will be carried by antibody to the target of the cancer. The logic application of this strategy is because the cancer, every cancers, they have their own antigen, specific antigen that can be only recognized by specific antibody. So in order to carry the anti-cancer drug to the target site, we can conjugate the anti-cancer drug with the monoclonal antibody in order to be specific to reach the target, and the drug will be released on the site, and then the drug will do their job. Actually, not many of drug that has been successful to be conjugated with antibody. For example, is Acetris. It is approved in 2012 for non-Hodgkin lymphoma. And second one is Kadcyla. Is for breast cancer. This antibody is specific to antigen, HER2 positive patient. This one is very effective because the drug is brought directly to the target site. This is the concept of antibody drug conjugation. This one is cancer cells. Surrounding cancer cells, they have antigen that can only recognize specific antibody, and then that antibody will be conjugated with drugs, and the drug will be carried by the antibody to reach the target. So on the surface of the cancer cell, the antibody will be internalized with the drugs. Because of different pH inside the pH inside the cells. Later the drug will be released, and then the drug will do their job to bind to DNA, for example, inhibit cancer cell growth. Brothers and sisters, I would like to share with you source of drugs. There are 4 types of drug source. The first is natural products. It is from plants. Can be from animal, and also can be from a microorganism. Next, from chemical synthesis. It is made in the laboratory. Number 3 is biosynthetic drug, or biotransformation. This one is produced inside the culture. I mean, we use microorganism to do modification on the chemicals, and then it will produce a drug. 3 of them, we call it a small molecule. Small molecule. Small molecule here is non-peptide drug. So the size of this small molecule is just about 500 kilodalton. And the last one is recombinant DNA product. We call it a macromolecule. It is a peptide product. It can reach about 150 kilodalton. So that there are option. There are option now. Whether we want to use chemical drugs that we call it as small molecules, or we use recombinant DNA product. This is a peptide product. So with regard to small molecules and macromolecules, I want to share with you just to compare between 2 different products, which is used in diabetic. Metformin, for example. Metformin is used to lower blood glucose. And insulin is also used to lower blood glucose. if we compare, both macromolecule and small molecules, small molecules, the structure is simple, and macromolecules, the structure is large, small molecules, the structure is single defined structure, and the macromolecules is complex structure. And small molecules, they have the structure, the reaction is predictable, to do the reaction to produce it, and macromolecules derived from living cell, it is used through fermentation process using a living organism like cells and also bacteria. Then about stability, stability, small molecule, because it is chemical drug, it is quite stable, and macromolecules, it is very sensitive to heat, about the characterization, small molecule is easy to characterize, and macromolecules difficult to characterize, and this another differences, with regard to minimal data packet and also robust data packet. Brothers and sisters, nowadays, as we saw in the top selling pharmaceutical product, mainly now is with regard to recombinant DNA technology product. Human being is created with complex manners. I mean, for healthy people, they're able to balance everything. For example, for people who are healthy, they don't have problem with insulin. But in a certain condition, due to environmental factors, they are not able to produce insulin, for example. So that the treatment nowadays, of course, we couldn't compare between metformin and insulin, but insulin is actually produced by our body, and then it is more acceptable by our body. Not only insulin, other type of interleukin, interferon, for example, is also a recombinant product. It is produced by our body as well. This interferon is very effective against cancers. If we compare between the treatment with interferon and any anti-cancer drug, the effect is different. The anti-cancer drug will give very harsh side effect to the patient. But if you use interferon, it is already recognized by our body, so it will be easy to manage, and it can be used to treat the cancer. So I want to share with you the production of macromolecules like insulin using recombinant DNA technology. In the recombinant DNA technology, we are able to produce recombinant product in fermenter. Before the introduction of recombinant DNA technology, around 1923, for example, Frederick Banting isolate insulin from the pancreatic cell of the dog, to treat children, who are having diabetic. So with the recombinant DNA technology nowadays, the process of production of recombinant DNA technology also expanded, and you see the process of production of recombinant insulin, for example. Human pancreatic cell will be isolated. The DNA of human pancreatic cell will be isolated to get his DNA, and then it will be combined with factor. And then after that, we will transform into bacteria, and this bacteria will carry the insulin gene, yeah, and then after that we culture it in the plate, yeah, and then we transform into large-scale fermenter. So if you compare it, yeah, if you compare it with development, yeah, of new drug from plant source, yeah. So this is the flow chart, yeah, of the development of drug from plant source, yeah. So the reason, yeah, actually to develop one candidate from plants can be from ethnopharmacological approach, yeah. The plant has been used by people for many times, and then there is no scientific evidence for that. So we can take it, yeah, bring it to the lab to get scientific data, yeah, in order to support to use the use of the plant, or through random selection, yeah, and also can be from chemotaxonomic approach, yeah. So the process is like this, yeah. The plant material will be extracted, yeah, and then it is part of the drug discovery development chart that I saw just now, yeah. And then the plant extract will be tested, yeah, for their toxicity in vivo and in vitro, and also for their in vitro and in vivo activities, yeah. And then the plant extract will be isolated using chromatography, yeah. And then we get pure compound, yeah. Again, the pure compound need to be tested, yeah, for the in vitro and also in vivo activities, and also for their toxicity. And then the pure compound will be elucidated using spectroscopic method, yeah. And then the pure compound also need to be formulated, yeah. In this case, we call it pre-formulation, yeah. And then the pre-formulation product will be proceeded into clinical study. So nowadays, when we get to COVID-19, right? So the people nowadays propose some plants, yeah, some extract, some essential oil to be used to treat COVID-19. If we follow the chart, yeah, the process is not just simple like that, yeah. It must undergo the complete process, yeah, because we have to responsible actually, yeah, with the activity and also toxicity, yeah. So the use of the plant for cure cannot just only based on the testimonial, yeah. It must be based on scientific evidence. Brothers and sisters, I would like to share with you my journey and research, yeah, personal experience. My interest in drug discovery and development was started during my final year project in University of Analysis. At the time, I was joining lab with Professor Taher Arba'in. His project is with regard to rubiaceae plant. Yeah, rubiaceae plant is very easy to be recognized. Yeah, of sampled coffee. Yeah, it is also rubiaceae. Yeah, tea plants is also rubiaceae. What the uniqueness or what actually the factor, yeah, that rubiaceae plant is very interesting, because they have they contain, yeah, alkaloid, yeah, alkaloid, especially indole alkaloid. In drug discovery and development, we should also understand the binding process. The binding process of drug with the receptors. The special thing with the alkaloid is because they have nitrogen atom in their structure, cyclic. Yeah, it is responsible to bind to receptor, which is also protein, yeah, through hydrogen bond. Mainly the compound that has nitrogen atom in their structure, they will they will have pharmacological activities. And then after graduated from that university, I moved to continue my study in University Technology Malaysia to study gatiferae plants. Gatiferae plant is plants which produce yellow latex. Yeah, it is under mangosteen trees. Yeah, what is the unique or the interest thing on this plant? Yeah, because the plant is rich with xanthan. Yeah, xanthan is flavonoid. Yeah, which has hydroxyl group in their structures. Yeah, so this kind of compound is very good. Yeah, in antioxidant activities. Then with regard to my experience in rubiaceae plants, yeah, I work with Ophidiaceae species. Yeah, Ophidiaceae species is a herbaceous plants, yeah, that contain alkaloids, yeah, saponins, phenolic, anthraquinones, and also flavonoids. One species from Ophidiaceae genus is containing camptothecin. Yeah, camptothecin is an alkaloid that active to inhibit topoisomerase DNA, yeah, DNA topoisomerase, which is very good and to be used in anti-cancers. But this camptothecin, yeah, compound is less active, yeah, or physicochemicals unfavorable because of maybe, and also because of their side effect as well. So I want to share with you the strategy, yeah, in drug discovery and development. We isolated compound from the plants and got lead compound. Yeah? If the compound is not active, or perhaps it has a toxic effect, so we can do something on the structure. Meaning we use that compound as the inspiration, yeah, to do modification, yeah, toward derivatization, yeah, and it has happened to the camptothecin. Yeah, it is actually not it cannot be used for cancers because of unfavorable properties. Yeah, so in drug discovery and development, with the a collaboration with chemists, yeah, we can do the derivatization, yeah, to have its analogs. Yeah. So what happened to this camptothecin when they do some modification on the structures? The camptothecin has been converted into topotecan, yeah, and also irinotecans to produce this clinically available anti-cancer drugs. And then the challenges in drug discovery from plant is because of a limitation of the source sometimes. Yeah, like this Ophidiaceae, actually this plant is quite rare. Yeah, but it has a very interesting compound. So what the strategy actually to sustain, yeah, the production of the compound, they use cell culture, yeah, plant culture method to produce high yield of the active ingredient. Yeah, so this is the strategy in drug discovery from the plants. Yeah, for your kind of information, like vincristine nowadays that has been used to treat leukemia cancers. still obtained from plants because of the complexity of the structures. The researchers are not able to make it in the lab. So it is still produced by direct extraction. That's why the cost of the treatment using pancreastins is quite expensive because of the yield. Yield from the plant extraction is very low. So we have to use very huge raw materials in order to get 1 gram or 1 milligram drugs. And my experience in natural product is on color film or bentangos. What is the special with color film? Color film is also under Gatiferae family. You still remember in 1988, some researcher from National Cancer Institute published their compound, is calanolide, to be used for HIV. But nowadays, this drug is not yet available in the market. But based on a clinical trial, the calanolide is quite promising. So I try to get involved in this study, but we are not able to get the same compound as obtained from color film laminarum from Sarawak. What we obtain just few compound, new compound, enalfosanone, it is active antimicrobial, and also beta-galactantone, it is cytotoxic. Brothers and sisters, in drug discovery, the crucial process is on in vitro studies. In vitro study is part of preliminary testing, to check, to investigate or to evaluate the drug candidates, for their activities. So in vitro studies can be done using chemical or reagent, and also can be done using enzyme, microbes, and also cell lines. Throughout my experience, I have done this kind of study, using in vitro study for antioxidant, antidiabetics, anti-inflammatory, anti-cancer, anti-glycemics, and also anti-VC, as well as wound healing. I would like to share with you my experience in in vitro study of cinnamon. This study was done during my PhD in UTM to investigate the effect of cinnamon bark on cell lines in order to check whether the compound is able to improve glucose uptake or not. And what we obtained from the data, so that the active compound from cinnamon, call it as cinnamomethionine B. Actually, this one is polyphenol compound, pro-anthocyanidin compound, is active as insulin mimicking, meaning it acts as insulin. This one we tested in vitro study using adipocyte cells. Adipocyte cell is quite interesting cell to be used in diabetic study because adipocyte cell is rich with insulin receptors, other than compared with other type of cells, yeah, adipocyte cell is very good to study anti-diabetic. Based on our finding at the time, 2006, our finding was published in local newspaper, yeah, and the title is "Sweet Hope for Diabetics." Yeah. Sweet, I mean, because cinnamon is called as kayu manis, and then actually we successful to isolate this compound, yeah. And I tried to test it. Actually, the compound is also sweet, yeah. So the journalists at the time take that opportunity to put the title in the newspaper. Other type of study that I have been done in using cell culture is to using cell, yeah, for wound healing activities, yeah. In wound healing activities, we use cell by monitoring cell movement or cell proliferation, yeah, after we scratch the cells, yeah, for a few days, yeah. So the fastest movement, just to show the preliminary result, it probably has wound healing activities. As, other part of the drug discovery and development is using animal study. Yeah, animal study can be done using any types of animal. Yeah, like fish, birds, pigs, mouse, rat, rabbit, and also monkey. Yeah, the use of animal in drug discovery is highly regulated by some bodies, yeah, like OECD and IICH, CPC, because we cannot just simply use animal directly without proper previous data, yeah, from in vitro. Because the use of animal in drug discovery is strictly regulated by following the 3R rules. Yeah, reduction. Yeah, we need to reduce the number of animals to be used. Yeah, if you have to do it. Yeah, and refinement and also replacement. Yeah, it is possible to use other type of assay, yeah, other than to use animal in the study. The advantages of using animal in drug discovery compared to in vitro, because animal is complex, yeah, complex, just not complex. It gives feedback, yeah, to the drug that we test. Yeah, it can give the data on pharmacokinetics, yeah, pharmacodynamics, physiology, and also pharmacology. Yeah. Based on our experience, we have done this kind of study using animal for anti-hyperglycemic, yeah, wound healing, anti-tumor, and also anti-nociceptive. The goal of the study is to understand the mechanism of action. Brothers and sisters, after we got the data that the drug candidate is positive, I mean, showing good activities in vitro and vivo, next we have to do drug formulation. Yeah, drug formulation is important because it can be responsible, yeah, for the successfulness of the drug discovery and development. If you still remember about the chart that I saw you in the beginning of the presentation, about 10,000 candidate, yeah, those who are those candidates that can be proceeded to this process is just maybe about 5,000. Yeah. So from this 5,000, you can reduce the number. So so many drugs that have been reported to be positive in vitro. Yeah. But when we give it to animal, yeah, the drug is not effective anymore. Or even if we give it to human, the drug is not active. Yeah. So drug formulation is play important role with regard to improve the efficacy. Yeah. Nowadays, the development of the formulation, yeah, the people tend to do nano formulation, yeah, nano formulation with different type of polymer, yeah. For example, gold nanoparticle, micelles, yeah, nanospheres, and so on. These nanoparticles is very useful, useful to deliver the active ingredient with following properties: biocompatible, biodegradable, non-immunogenic, and have long shelf life, and also exhibit high stability. As part of this formulation into our study with colleagues, we try to formulate drug using vesicle. This we use nisomal. Nisom, actually this one is using polymer, that can be used to deliver drug to the skin. And for this study, we have successful to formulate hexachlorophenic proneosome. This one is created by Rana, our student, and also raloxifene transversome, by Dr. Mahmoud. Brothers and sisters, in our recent study, using Garcinia mangostana, mangosteen, we have successfully isolated compound, namely by beta mangosteen. Actually, beta mangosteen is the most active compound, from based on our experience. We have done some studies, some also published some articles based on Garcinia mangostana. Beta mangosteen is actually the most active compound for cytotoxic activity, from Garcinia mangostana. This compound is active against KOP2 cells, MCF7 cells, H1299 cells, and also A549 cells. But the limitation of this beta mangosteen, because of solubility and low bioavailability based on in vivo studies done by other researchers. One of the strategy that we propose is using pegylated liposome. Liposome is made by phospholipid and cholesterol. In this technology, we try to envelope the compound with this polymer, and later we extend the size of this vesicle with polyethylene glycol. So additional of polyethylene glycol to the structure can extend their solubility and improve their pharmacokinetic and also pharmacodynamics. Example of using pegylated liposome is in doxil. Yeah? Doxil, researcher has used pegylated liposome to deliver doxorubicin. Yeah? The name of the drug is doxil, and it's found that the compound is that the drug is giving some more efficacy compared to naked doxorubicin. Brothers and sisters, I would like to share with you my experience on other type of plant. Yeah. This time I would like to share what pegaga. Yeah, pegaga is Centella asiatica. Actually, this one is this plant is quite miracle. Yeah. Miracle means it is it has a lot of benefit. Yeah, to people. Yeah. Pegaga is daily used by Malay people as an ulam. This plant is containing triterpenoid, acetylcholine, malicososide, malic acid, and also acetic acid. So what we did with this plant, we try to develop our own method to extract, in order to get a rich content of acetylcholine in the extract. So this project, this project has been funded by some institution like Ministry of Higher Education, MPDC, and also MIRGS. This one is under IIUM. So what we did in this study, we develop our own extraction, and then we do analysis, in vitro and in vivo studies, and then to develop skin, cosmetical, and also for skin health, and then we try to develop the product, to be in hydrogel, nanofiber, and also as a serum, and then this product is patented, fill the patent, and this is the product that we have developed from pegaga. This one is nanofiber, but still in the preliminary study, and we are going to develop hydrogel for wound healing, for chronic wound, and the product is serum. Serum is for cosmetic purpose, and this one is under market validation by one company. This one is part of the pre-commercialization process. Brothers and sisters, I would like to touch a little bit with COVID-19 context, because we are facing the challenge in the global pandemic, the virus, SARS-CoV-2 virus, as we know, this virus is deadly, virus, based on the report as of 6 August 2021, there have been 200 million more, confirmed case, and more than 4 million deaths, so this disease is spread by droplet, and so in everyday life we need to apply SOP, by wearing masks, and also to avoid any crowd, So with regard to this COVID-19, many actually efforts, have been introduced, including new drugs, and also new herbs, and also vaccine, So with regard to the introduction of new drugs for this COVID-19, yeah, there are some possibilities that can be proposed. Yeah, the first can be a drug that can block the acetylcholine esterase 2 receptors. Yeah, and also by proposing antiviral drugs. Yeah, since the outbreak of the COVID-19. End of 2019, yeah, the people tried to study the virus, yeah, how actually the virus infect the cells, yeah, where the cell is binding, and then the researchers come up with the proposal, yeah, even with the current what you call the treatment proposal, they use ivermectin sample, but the drugs need to be, need to undergo clinical trial, yeah, clinical trial again, because it was mainly for parasite, yeah. Parasite is to be used just only after 3 months, and can be 3 months to 1 year use, yeah. But if we use it for every day, for example, 3 times a day, it is afraid that that can produce some side effects to the people. Yeah? So the strategy actually in the treatment, yeah, to cure COVID-19 is through this proposal. Yeah, maybe with the recent publication, maybe they have also some proposal. Yeah, so blocking the receptors, and also antiviral drugs like binding to the enzyme, yeah, of the virus. Vaccine is actually developed using the same chart, yeah, similar chart, yeah, with the drugs, yeah. To achieve 50% herd immunity, yeah, some pharmaceutical company has proposed about 287 vaccine candidates, yeah, and 103 in clinical trial, and 8 are already marketed, yeah. So there are some formulation, yeah, some development on vaccine, yeah, like Pfizer, they use RNA vaccine, yeah. This Sinovac, they use conventional vaccine, yeah. Just to share that actually the development of vaccine is not instant, yeah, it's not instant. Just to give some insight there. I mean, it has been undergo the proper, yeah, and strict process so that the vaccine can be used to the people. Ladies and gentlemen, now I come to the conclusion. Yeah, indeed, the drug discovery and development is very costly and timely. Yeah, it is about 12 to 15 years process, can consume about $1 billion. Yeah, so among the 100 candidates, yeah, so about 90.9% is failed. Yeah. It is because of poor hypothesis. Similar to COVID-19 pandemic nowadays, many proposals, candidate have been proposed, yeah, to be used for the treatment of COVID-19. But actually, if we seriously do it in this research, most probably the candidate will be failed, yeah, to be available in the market. And then the fail is also because of irreproducible data. Data cannot be reproduced, yeah, and ambiguous clinical models, and also inappropriate statistical models. And the last one is insufficient funding, yeah, because of the insufficient funding, the drug may be the candidate maybe not being proceeded for the studies. And if it is successful, yeah, it's about 0.01%. So the product will be marketed, yeah, and commercialized. So the process is not end until that. Yeah, the clinical trial is still in the process. Yeah? We call it as phase 4. Yeah, phase 4 to monitor. Yeah, to monitor the effect for long run. Yeah, whether the drugs is showing any side effect to people or not. Last but not least, I would like to express my deeply gratitude to my parents, Haji Bakhtiar bin Muhammad, my late fathers, and my mother's Animar bin Tisiran, for their sacrifice, for their tear, and for their love for my life. And also to my brother and sister who contributed to my study. And I would like to express my thanks to my family, my son Naufal Lufi, so my daughter Luma, and to my wife Denise Swanti, especially for designing this slide. And also I'd like to extend my gratitude to my former postgraduate and undergraduate students, to grant providers, Kulliyyah of Pharmacy, Office of Campus Director, IIUM, collaborators, and colleagues. With that, thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Prof, for your remarkable talk. Indeed, the talk benefits and enlightens us about drug development, drug discovery and development. We will now go to the Q&A session. I would like to read question from Dr. Izzuddin, Kulliyyah of Allied Health Sciences. This question is, what's the difference between ethnopharmacological and chemotaxonomic approach for natural product selection?
Okay.
Prof, please.
Okay, thank you very much, Dr. Izzuddin. Actually, the approach of the drug discovery based on chemotaxonomic and also ethnopharmacological. For ethnopharmacological approach, it is based on the use of plant by tribes or by people. They mentioned that the plants or herbs have been used for a long time, yeah, in the tribe in order to get benefit from them, for example, for diabetes. So we go to the tribe and obtain the plant. We do our research, yeah, based on their verbal data, yeah. And the chemotaxonomic approach is based on chemical content, yeah, chemical content. As I mentioned just now, like rubiaceae plant is very rich with alkaloid that can give pharmacological activities. So some researchers they are using chemotaxonomic to find other species that can be other species from rubiaceae family that they expect that the plants, yeah, also has the same, yeah, or similar compound. So that is based on chemotaxonomic approach.
Thank you, Prof. You have more questions coming in, but I would like to read another question from Dr. Sophia Samsudin from Department of Quran and Sunnah, our Islamic River Knowledge and Human Sciences. Assalamualaikum, Prof. Can I have your comment on ivermectin? Ivermectin, please comment, Prof, on this.
Okay, thank you very much, Doctor. Actually, I would like to comment. As a pharmacist, normally we are not simply claim with regard to the activities of certain drug or certain herbs. That's why if you can see out there, actually the people who are easy to claim. For example, the product is active for Tokyo, Tokyo, this type of disease. But if you ask me personally, actually, ivermectin that is available in the market, the indication is not for viral; it is for a parasite. As we know that parasite, just the frequency of the treatment for the parasite is just only once a year for months, yeah. And then if you give it to the patient, I'm not denying that ivermectin is not positive. To treat COVID-19, but we need to do proper study for that, especially for clinical trials. Even though the drug is not new, maybe it no need to follow the whole process. We can jump to clinical trial to study their toxicity, because in clinical trial we have some phase there, 1, 2, and 3. In phase 1, we need to see the effect to the healthy volunteer, and then phase 2, we need to check it to the number of patient, the patient with the disease, and number 3 is another number of patient to see the effect. So to me, the use of ivermectin without proper is not really encouraged, because for long run of the use, it can cause a toxic effect or teratogenic effect to the patient. That's why in drug discovery and development, after phase 3, there is still phase 4. Phase 4 actually to monitor the drug whether it is okay or not, giving any side effect or not to the patient. And then maybe if it is not good, maybe the drug will be withdrawn from the market. So the conclusion is we have to be before the result of clinical trials. I don't recommend to take because we take it 3 times a day, right? Huge dose. Even for the patient with the parasite, just only 165 milligram per year dose. Now you take we take 3. I'm not sure the regimen of this ivermectin for daily use for COVID, but it will be very huge, very huge. That's my opinion. Thank you very much.
Thank you, Prof. We have another 4 questions total before we end the session, Prof. So next, again from Dr. Izzuddin Kas, regarding proposed mechanism of entry, SARS-CoV-2 involving ACE2 inhibitor, ACE2 receptor, right? Is there any available ACE2 inhibitor in the market? If yes, has there been any studies to see the effect of the inhibitor on COVID? Please, Prof.
Yes, quite challenging question. That's why after outbreak of COVID-19 in December 2009, the people tried to study about the COVID-19, how actually the cell infect how about the virus infect the cell, how the virus enter the cells. So actually the gate of the virus to enter the cell is through this receptor. Yes, actually, so many type of drugs that can inhibit SAE2 inhibitors, actually, like cardiovascular drug sample. But I'm not following this study as well. But one possibility is just to develop, to block, as a preventive measure, to prevent the virus to enter the cells. I cannot answer that whether the product is available to give that action or not. I'm not following this research. Thank you very much.
All right, thank you, Prof. this one another one question from Dr. Tunku Faris, your student, yeah, from Kulliyyah of Nursing.
Yeah.
One major hurdle of therapeutics is to translate drug-based in vitro findings into in vivo data. Based on your experience, how do you control this? One major hurdle of therapeutics is to translate drug-based in vitro findings into in vivo data. Based on your experience, how do you control this, Prof?
Actually, I couldn't control it. I couldn't control it because it is actually the nature of the selection. Nature of the selection, as if you still remember with the chart, about 10,000 of the candidate. Just only one will be available on the market after 15 years. Yes, actually, the mistake maybe is not to be, to be given to the candidate. Yeah, the mistake maybe because our method, for example, in order to improve their delivery. The major problem when we transfer from in vitro to in vivo is with regard to the physicochemical properties of the drugs. That's why pre-formulation or formulation is important. Let's say the in vitro is based on water-based, for example, and then when we give it to animal, and then in animal is complex enzyme and so on, maybe the drug will be or degrade by enzyme, for example. So that one we have to overcome. Yeah, we need to study. Yeah, majority, yeah, the study on this step, yeah, and this step in vivo fail, yeah, fail because we couldn't find the best way actually to deliver the drug, yeah, to transfer from in vitro to in vivo, and also to human purpose as well. So we have to. That's why actually it's one of the. To do research. So research is very important here. Yeah, to do some kind of improvement with regard to delivery of sample formulation and so on. Yeah. Thank you.
All right, thank you, Prof. Another question from our colleague in KOP, in Kulliyyah of Pharmacy, Dr. Izan. The issue with natural product studies, from what we observe in Malaysia, not many really focusing on isolate the active compounds related to the studies. In addition, we know that not many really control the plant. For example, they just randomly take the plant from a while, which we know without really controlling the growth of the plant. This will also affect the studies. Can you comment on these issues? As we see researchers in China are also leading in their traditional medicine as well. So, yeah.
Okay, thank you, Dr. Izzat. Actually, that's why I mentioned in my book, actually there is valley of death there. We fail to translate. Yes, we get the plant extraction. Actually, the use of plant, because the huge opportunity, yeah, the drug candidate from plants. So, the possibility to find new drug candidate from plant is very high. It's very high, and then the drug candidate, it can be used directly, or we can do some modification on it. And then the challenge is because of there is no continuation of the research, because we know in university we depend on the research grant. I am facing that situation as well. That I found that some candidates are potential, but because of the limited grant and grant is finished and we apply another grant, we don't have. We not successful. So that's it. That one of the valley of death. Unable to translate. Candidate to the market. Yeah. That's all.
All right. Thank you very much, Prof, for your answer. And we have the last question for this session from Dr. Zakwan, Kulliyyah of Science. Salam, Prof. Congratulations on your professorial talk. Many congratulations you, Prof, in the chat box and it's also in YouTube. So the question is, what is the greatest challenge throughout your journey as an academic in IIUM? Please, Prof.
Thank you. That was a good. What's my greatest challenge? I think my challenge is similar to your challenge, Dr. Zakun. But to me, I'm just ordinary lecturers actually, because as an academician, we need to do this, to do that, research, teaching. But to me, I have to utilize I need to do my best in whatever I involve. So for teaching, I try my best, but even though the result may be not best. So as academician, I think the challenge actually depend, cannot be fit to everyone. Yeah, we can't, because the different lecturers, they have different motivation, different but I don't have very much challenge. To me, if you ask me honestly, yeah, because maybe because my dream is not really too high to be achieved. So just proceed my life as an ordinary. Ordinary academician meanings you have to do research, right? So you have to do teaching, whatever, consultation, maybe, admin work. That's my answer. Thank you.
All right, thank you, Prof. I cannot neglect a question from our friend, Dr. Yusuf from KAS. Salam, Prof. Very inspiring. What is the most depressing moments in your life, your research life? How you overcome it? What is the lesson that we can learn, Prof, from Dr. Yusuf? What is your most depressing moment in research life?
My depressing moment in my academic life is I grant student, so on. For example, now I'm depressed because I don't have any student because it's COVID-19 situation. Actually, we cannot blame anyone. So just proceed my life as usual. So we hope that future is brighter than now. So yes, because the question is with regard to academician point of view, right? So the answer is with regard to the grant. The grant, you couldn't continue our dream or our idea actually, because limited grant is available. So this just again to emphasize that value of this, one of that, in research, translation of research is one of them is with regard to grant, and also no grant, no student, no grant, no student, no data, no the publication, right? No publication means yeah.
Yeah, it's like a cycle, right, Prof? No money, no research, no student, and so on. Yeah. Thank you, Prof. Thank you to all participants who joining us today. Please, we have shared the link for the ebook of Prof. About this drug discovery, development, and discovery and development ebook. Please pre-order the book. This is a complimentary from IIUM Press. All right. So we have now reached the end of the session. We hope that you have gained a lot of benefits and take-home messages from the session.
Dr. Salahuddin, please, I want to interview you. There is another one more question. Please allow to answer that question.
All right, okay. We have another question from Prof.
Shri.
Yeah.
Dr. Aisha is asking. Please.
All right. Okay, this is a question from Professor Datuk Sri Dr. Asia. Assalamualaikum, Prof. A small question. Regarding your research related to mangosteen, is there any product that you have produced, and it is for what benefit? Prof is from Kulliyyah of Architecture.
Thank you very much, Prof. Because of actually, I'm willing to develop the research to find a product. For example, for mangosteen, because mangosteen is actually potential not only for cosmetic. So far, mangosteen is used for cosmetic, right? Cosmetic for skin. Actually, mangosteen is very potential because they have interesting phyto compound, yeah, for example with mangosteen and also other xanthons. As we said just now, actually the main the situation, yeah, that blocking our dream actually because of the grant, the limited grant, and also limited grant, so limited student as well, so it cannot be proceeded into the. I have actually idea to develop mangosteen to be a product, but so far I don't have product from mangosteen. But actually, this is very potential. Source, yeah, for the drug.
All right, thank you, Prof. Taher. I think I can accommodate one more question before we finish in 2 minutes time. It's from your student as well, Miss Hani Suhana. Yeah? I have a question here. How do you convince yourself in the midst of doubt when you want to pursue your dream? Any advice, Prof? And last question for this session, inshallah.
Oh, it's very, thank you, Anis. Actually, what I try in my life is just to be not to be best in my area, but I try to do my best in every single step that I did. Yeah.
All right.
Whatever you do, just try your best.
Yeah.
If you are doing whatever sport, whatever, please to be best in that area. Maybe you are becoming athlete and got medal in Olympic tournament. That's all, Anis. Actually, Anis just try to test me what is.
All right. Maybe we can. We have reached the end of the session. Thank you very much, Prof, for your sharing session. We have benefited a lot from you. We know about this and drug discovery and development, how the drug is discovered and developed until we get into the market, right? So sometimes like the anti-cancer drug that you shared with us, it is from the plant. We don't know whether it is from the plant. Also the aspirin that we eat also from the plant as well. So it's very important that we can discover, because everything, every disease we have the dawa, we have the penawar, yeah? Yeah. So we need to search for the best, yeah, for us, yeah. Right, before we disperse, I would like to ask everyone to open your camera for a photography session. Please open your camera. We would like to shoot all of us here as a memory. Secretary, please snap us all.
Okay, smile. 1, 2, 3. Kita ada 5 page. Second page, smile. Third page. Okay, last page. Done. Thank you.
Thank you very much, Sister Jihan. So thank you very much for your kind attention and participation. With that, the session is now adjourned with the recitation of Tasbih Kafarah and Surah Al-Asr. Assalamualaikum warahmatullahi wabarakatuh. Thank you again, everyone.
Thank you, moderator, and everyone.
Alhamdulillah. Thank you, everyone.
Alhamdulillah.
Thank you semua.
We call for postmortem later lah. Call for it.
Alright. Okay.
Okay, insyaAllah.
Thank you. Assalamualaikum.
Assalamualaikum warahmatullahi wabarakatuh.